Hi, my name is Mason Cosgrove, and my report is on poliomyelitis. Now, what is poliomyelitis? Poliomyelitis is also known as polio or infantile paralysis. It's a crippling, potentially deadly infectious disease caused by the poliovirus, which is a subtype of the enterovirus C, which invades the nervous system and can cause acute asymmetric flaccid paralysis, can cause a debilitating muscle disorder, which affects the motor neurons in the central nervous system. Now, polio is generally affects kids. It's most commonly found in babies younger than 6 months, but anybody can be affected by this because it's extremely infectious. And the effective eradication of the poliovirus in the Western world, the Western Hemisphere, is arguably one of medical's greatest achievements. Now, the classification of it, because it's a virus, it doesn't necessarily fall under the 3 domains of life. It does not have a kingdom or a phylum. It is classed in group 4, which is single-stranded RNA that are positive. Its order is Picornaviridae. Its family is Picornaviridae. Its genus is Enterovirus, and the species is Enterovirus C. And like I said before, poliovirus is a subtype of this Enterovirus C. There are 3 serotypes of the poliovirus: poliovirus 1, poliovirus 2, and poliovirus 3, which are all differentiated in the capsid protein that it possesses. Poliovirus 1 is what we're mostly associated with. We're most commonly known, used, which is occurs paralysis. Poliovirus 2 was eradicated in 1999 in India, and poliovirus 3 has not been seen since November 2012. Now, other subtypes of this enterovirus can cause polio-like conditions like acute flaccid paralysis. Now, the pathogenesis of this, the virus enters the mouth, which is fecal-oral route, and because it's an enterovirus, it likes to replicate, especially in the intestines, where it replicates in the epithelial cells. It can also replicate in the throat, the pharyngeal lymphatic tissue, and after it replicates, it gets into the central nervous system. We aren't sure how, but there are 2 theories going around. Viremia, which is via the blood, and it finds its way to the specific target in the spinal cord, which is the neurons. Now, another theory is the retrograde axonal transport, which basically translates to backwards axonal transport. So these neurons reside in this anterior horn here, and this poliovirus somehow gets into the axon here, travels backwards, and replicates and damages the neurons. Now, this interferes with this highway of transportation between the spinal cord and your muscles because they send chemical reactions, and this is damaged. This is because of the degeneration of the Nissl body, and when this degeneration is reversible, phagocytosis is occurred by the leukocytes and macrophages. Now, these lesions in this anterior horn cause flaccid paralysis. It could also cause encephalitis in the brainstem and motor and premotor areas of the cerebral cortex. Now, the virus can cause 1 out of 4 conditions: asymptomatic polio, minor, non-paralytic, and paralytic. Now, the diagnosis of this, obviously your symptoms, but lab tests can go and confirm if you have the active virus in you. Now, the virus replicates in 3 places, so there's 3 different tests. The throat, which isn't as commonly used, you just swab the virus in your throat in Petri culture. The stomach and intestines, you isolate the virus in stool culture, and this is most commonly used and because it's cheap. And then you can also do it via cerebrospinal fluid, which is from the spinal cord, via a spinal tap, and this is more expensive and obviously hurts more. And the detection of the virus can also be diagnosed via polymerase chain reaction. Now, the infection can be inapparent and apparent. Inapparent is 90 to 95% of cases, and apparent is 5 to 10. If you have asymptomatic polio, which is 90 to 95% of the cases at the time, you can have minor polio, which is 5 to 10%, and you get just mild symptoms like your basic immune response, You get if you have non-paralytic polio and paralytic polio. And paralytic polio is 0.5% of people who experience these muscle symptoms. Now, complications can occur like myocarditis, pneumonia, UTIs, and skeletal deformities. Now, in non-paralytic poliomyelitis, this is about 2% of infections, and symptoms can include your basic immune response, but you can also have signs of stiffness, which can be tested with these tests, like kiss the knee test, where you are asked to kiss your knee, but because of the stiffness in your back, causes a reflux for your knee to come forward. As well as a head drop test and neck rigidity. And recovery is within 2 to 10 days. Now, paralytic poliomyelitis occurs in 0.5% of people who experience muscle symptoms. Now, there is a minor phase, which is just your basic immune response, and then your major phases, which is your atrophy, your muscle weakness, your low tone, and twitching of your muscles. And the twitching occurs because of the motor neurons, their involuntary responses. Now, this is followed by a rapid onset flaccid paralysis, complete within 72 hours, and there's 3 different types: the spinal paralytic polio, bulbar poliomyelitis, and bulbospinal. Complete recovery of this results after 6 to 24 months, but some cases can be lifelong. Now, here's an example of pre-paralytic symptoms, like your stiff neck, your stiff spine, you have a head droop, and your navel, when you lift up, is forced outwards, as well as your diagnostic tests here. And paralytic features is, here's some of the flaccid paralysis of the facial nerves, which is the bulbar polio. You can have atrophy in your muscles in your legs or your arms. Now, how you see how this leg is thicker than the other, this is because it's asymmetrical, and just because a neuron, say, in this leg is damaged, does not necessarily the neuron in this leg is affected. Flaccid paralysis in your trunk can also cause herniation, and can also cause deformities, like in this example here. Now, spinal paralytic poliomyelitis is most common, and it's about 80% of cases, and it affects the muscle, legs, arms, and your trunk. Severe cases can cause like quadrilepsia. Like I said before, the paralysis is asymptomatical. Your muscles are floppy and your reflexes are diminished. And sensation is normal, and residual paralysis is after 60 days. In bulbar poliomyelitis, this is about 2% of cases, and this can be life-threatening because it causes nerve lesions in your vagus nerve. Symptoms include like nasal regurgitation, dysphonia, dysphagia. Your child refuses to eat. And this is the involvement of the respiratory center, so it causes irregular respiration. Now, this is an example of an iron lung. This is actually the same person. This girl, her name is Martha. She got diagnosed at a very young age and has actually lived in this iron lung for 60 years. Another example of polio can be bulbar palsy, which affects the glasiopharyngeal cranial nerve, the vagus, the accessory, and the hypoglossal, which includes swallow difficulty, the movement of your throat, like talking, and also your heart. Your accessory nerve is your shoulder movement, and your hypoglossal nerve is your tongue movement. Now, polioencephalitis is very rare, and symptoms include irritability, delirium, disorientations, tremors, convulsions, and your paralysis of your upper motor neuron types. Post-polio syndrome can occur in about 80% of recovered polio patients, and it occurs years and years, like 15 to 40 years after initial infection. It's very slow, and it's progressive muscle wasting. And although this occurs normally in people via aging, your muscles are already weak, and they get weaker and weaker, which causes deterioration and dysfunction, which causes like in this man here, and this man here. And this is one of the severe cases here. Now, there's no treatment currently. It's just symptomatic support. You may need breathing and diaphragm if you have one of those severe rare cases like breathing tubes or iron lungs. It's generally just hospitalization. Braces might be applied to your muscles to help support. Physiotherapy as well. But generally there's no treatments currently. Now there's two vaccines actually going. There's an activated vaccine, and then there's an attenuated vaccine that's also available. In the US, we have the subcutaneous or the intramuscular. So at 2 months, we get our first dose, 4 months our second. Our third dose is given to us at 6 to 18 months, and then our fourth dose is between 4 to 6 years old. 99% of children out of 100 who get the recommended doses of the vaccine will be protected from polio. And even if a person who's previously been vaccinated, he or she still may need a one-time booster if they're traveling to another country that might possess polio. Now there's two types of vaccines, the Savin vaccine and the Salk vaccine. The Savin vaccine is live, but it's an attenuative vaccine. It's effective and it's given in 3 doses, which is a 95% efficiency. It is liquid, which gives it advantages and is very cheap. And this actually is given to lower income like places and countries. However, the disadvantages of it, you cannot give it to immunocompromised people like kids, elderly people, and mothers, pregnant mothers, you can never give it to because there's still a very, very small risk that the live virus can be virulent. Now, the Salk vaccine is what we have here in the U.S. It's injected intramuscularly. It's a killed form of the virus, so it cannot replicate and is very effective. Your first dose, you're 95% affected, and your third dose, you're about 99%. It's pricey, but it's really good for you. Now, the epidemiology of it, this endemic was prior to the 1900s. The first major outbreak in the U.S. reordered in 1916. About 6,000 people died and 27,000 were paralyzed. And now this one here, the peaks you see here are the different vaccinations. Tropical areas, you see more polio cases because it occurs more in the hotter climates, and the virus is able to replicate in warmer temperatures. So there's a big scare in the 1930s and 1940s for parents and their kids using swimming pools. It's highly infectious because it can be carried up for 7 to 10 days, and the infections is up to 6 weeks. Luckily, however, it's 90 to 95% never show symptoms, but the disease still spreads and it's extremely difficult to eradicate. However, we are lucky because humans are only the reservoir for the polio virus, so you cannot get it from another animal. Now, there's 3 endemic countries, Afghanistan, Pakistan, and Nigeria. Outbreaks are still occurring, but we have 16 cases worldwide left of the polio virus. And these countries in yellow here are at risk for polio spread, but do not have cases shown today. Now, where we are now, as I said, it remains endemic in 3 countries, Afghanistan, Nigeria, and Pakistan. Everyone's still at risk, which is very scary. The total cases are 16 as of November 2007. There's no new cases of polio. And then an update on the status of the 4 objectives of the polio eradication and endgame strategic plan are in effect as of this week. This is my Works Cited page. I hope you liked my presentation, and if you have any questions, I will answer them Monday. Thank you for watching.